Hi, I'm Dr. Tejal Shah. Today, we will be going over a crash course on caring for your baby. We, as pediatricians, usually like to see the newborn baby upon 1 to 2 days after discharge from the hospital. Reason being, for a good transition of care. So that being said, first and foremost, let's start with feeding. We, as pediatricians, usually recommend breastfeeding or bottle feeding, which is also formula feeding. It's personal preference depending on the parents and what works out the best for the family, especially the baby. If breastfeeding, we say feeding on demand, which can mean every 1 hour, 2 hour, or every 3 hours, and sometimes even 30 minutes, which is called cluster feeding, which is totally normal. With breastfeeding, we recommend vitamin D drop once a day. With formula feeding, we say feeding every 3 hours. Once the baby has gained their birth weight, you may be able to stretch the feeding frequency according to the baby's needs. Please consult with your doctor, pediatrician, as recommended. Next thing, let's talk about sleeping. We recommend A, B, and C alone, on their back, in the crib, or bassinet. No toys, no blankets, no stuffed animals until 1 year of age or above. It's not like they appreciate it before then, anyways. Make sure that the temperature in the room is nice and comfortable between 68 to 72 degrees and making sure that they feel comfortable as well. Next thing, it's very important to develop a good sleep routine, and sometimes that can mean as simple as giving them a bath before bedtime. A baby is able to have a bath after the umbilical stump has fallen off, and that can happen between 1 to 2 weeks and sometimes even 3 weeks of life. And next thing, let's talk about activity. You can do tummy time, everyone's favorite. We recommend tummy time once the umbilical stump has fallen off. Initially, it can be for seconds, and then eventually, as they are starting to tolerate it more, it can be for minutes. See how they're preferring it. We recommend doing it at least 3 to 4 times a week. Doing tummy time helps them gain a good neck control, which is also one of the factors we look into when trying to decide if they're ready to advance their feeds. There are many techniques and topics that your pediatrician will be discussing with you on the newborn visits. Just remember, if your baby is crying but consolable with feeding, peeing, pooping, sleeping, but not letting you do all of the above, you're doing all the right things. Congratulations on the newborn baby and welcome to parenthood.